Thanks for tuning in to Move to Improve, where you'll find honest conversations between chiropractors, other healthcare professionals, and the occasional elite athlete. So I'm here today with my co-host, Dr. Alex Fitzowich.
Hey guys, what's up?
And we have a new guest today. We're actually babysitting from here on out.
Yeah.
We got intern and soon to be chiropractic prospect.
You forgot the pro athlete part in there.
Oh,
too.
yeah. Justin Hodzinski.
Close.
Hodinsky.
It's a tough
There's
one.
too many hard names.
We're just trying to haze you. It's all. That's all we're getting
Yeah,
at.
it's part of the process.
Yeah. Character building, actually, it's the preferred term. So, first of all, Justin, Dr. Hodinsky, tell us about yourself.
Soon to be grad. Went down to Portland for school. Same as Matt here, and started off at the clinic for the next couple months, just checking stuff out, finishing my last little rounds of chiropractic school, and then fully graduated after that.
Gotcha. Long walks on the beach.
Yeah.
American Idol. Any other things? Okay.
No, nothing relevant.
Nothing. Okay, good. Okay, so today we wanted to tackle a huge kind of topic for us, very important topic, and one of kind of growing concern, and that's chronic pain, right? So we actually also tasked Justin with doing a little research, so he's going to be spitting out facts for us today. But chronic pain is something we all kind of probably know somebody that suffers with. And the idea of waking up with constant discomfort or daily aches, something that, you just can't get over, that idea is pretty frightening for most people. We never really want to, or we never really do see ourselves in that position, but it's difficult thinking long-term and far out and feeling like you can move past that when you're being underserved in the healthcare community. So, Dr. Alex, what can you tell us about chronic pain?
Yeah, I think chronic pain is a big problem in society in general because there's just so many factors that contribute towards it, right? So, if you don't know really what we're talking about, lots of people wake up with like kind of aches and pains, soreness in the morning. They're sore and stiff, but then they start warming up, get on with the rest of their day. Kind of occasional things. What we're talking about is more like, either low or high grade, kind of dull, achy pain, maybe sharp pain that happens all the time. Never gets better, never really changes, might move around. Like there's just, the biggest thing is that people feel like it's something that will never get better. That's something that happens all the time in practice. People will come in even with a relatively minor or relatively acute injury, and they'll say like, will this get better? Can you help me? All these kind of things. They're really worried about their chronic pain. And the issue with that is because pain is so multifactorial, the way that you perceive your pain also affects how you physically feel the pain. And so if this is something that you feel like you're going to have every single day for the rest of your life, it's never going to get better and it's only going to get worse, your perception and your feeling towards that will also make it worse as well. So it's kind of this snowball effect, and it can be really, really hard to get people out of this chronic pain situation. We see a lot of people that are in car accidents or, serious sports injuries or whatever it is, and they're worried that they'll never get better, and it ruins their whole life. Basically, it's not just physical pain anymore. It's every single element of their life. And so, even if you treat them and you can see that they're moving better, that they're feeling better, that their trigger points and their functionality are all improved, they don't necessarily feel that, and they might just still feel like they're getting worse. So that's really difficult on our end, that they're not necessarily improving, even though we know they're improving.
Yeah, that's the big thing about chronic pain and pain in general is there's a trifecta that goes into that, the biopsychosocial model of pain. And it's hard to really know to what extent what's contributing, but the way I kind of explain pain especially chronic pain, it's neurology, right? In some sense, we're treating the tissues, we're getting your joints relief, and we're trying to get the system healthy. But on a bigger level, we're treating your nervous system, and pain kind of works the same way like a memory does. It's neurology. That's the same. So every time you experience and re-experience or even ruminate and continue to think and how poor and how miserable this pain is, you're reinforcing that pain pathway. And that's why the longer you have an injury, the more difficult it becomes to get rid of it, is because that neural pathway starts to become ingrained. And so even when we do relieve the tissues and you feel good for a bit, it starts to come back. And that's why we really stress the importance of treating a long-standing issue, kind of like breaking a bad habit, where, you're going to get some degree of relief, but expect this to kind of want to come back. We're going to have to treat this again and get you that relief before it comes back. And kind of, as things get better, we can back off a bit, maybe not see you so frequently, but we have to keep in mind that this thing can rebound at any moment. And we've got to be ready to break that bad habit, because the more often you re-experience the pain, the more that memory becomes consolidated. Justin, I want to pass the torch off to you, because I know you did a little research before this, and is there anything you can share with us?
Yeah, so kind of piggybacking on what both of you said, there's the three types of pain people normally experience. We got like the nociceptive, so that's like, you cut your finger, so that's like high nerve endings, those are sending pain signals, so we have that. We have some sort of neuropathic pain, which is more like a nervous system thing. So you stretch and fall and you're getting pins and needles down your arm. You're damaging the nervous tissue. And then we have kind of more into the chronic pain side of things, the like central sensitivity, which is what you're saying, where your nervous system is just firing and it can't truly figure out what the cause of the injury is, but just everything around it. Your tissues, we have all the nervous system going in, and it's just the system's overloaded. So trying to figure out how to branch that off and impact people and get them, so calming their nervous system down so we can truly get to the root of the pain and figure it out from there.
That's a great point, and that's actually a phrase I use with patients all the time, is calming your nervous system down. So, let's say you have a neck injury, you wake up, you can't turn your neck, most common thing that we see in the clinic. And because of the area of that injury, and because it's so close to the nerves, it's affecting the spinal cord, the muscles, all of this complex structure in a small area, it will be, I tell people, much worse than it actually is, right? You're teaching those nerves that like, this is, a dangerous situation. We've hurt ourselves and we want to prevent further damage. And so we're going to tighten our muscles. We're not going to move as much. Everything's going to swell, like all of these different responses to pain. And part of that is like just reassuring your brain and your nervous system, like, hey man, you're not, your neck isn't going to fall off. Like, you're not going to do more damage. As soon as we can work with this response that we've kind of taught our body, right? This pain response. As soon as we can down-regulate that a little bit, people get faster, way, way better. But that's also in a relatively simple case, right? If they have other complicating factors, fibromyalgia, depression, anxiety, like all of these, mental things going on with them as well as just different parts of their pain, like those all get intertwined and combined. So we're trying to get them to not teach their nervous system to be super sensitive and trying to teach it to relax. But that's not just in a physical sense, right? That's their daily anxiety, daily stress, along with their physical issues as well.
Yeah. And that's a really big point that should be emphasized is, pain is a very subjective thing. And there are some people who would experience the same pain as an 8 out of 10, while others would experience that as 2 out of 10. And that's perception, right? And so people that really like soak, they really feel that pain. It's good in a sense, but there's a time to step away and be like, you know what? I feel this, but I'm not going to let this become me. I'm not going to identify myself as this injury. Now, on the other side of the spectrum, you get the people that, I'm just going to brush this off. I'm going to brush this off. It's nothing, whatever. They're tough people. However, if you do that for so long and then suddenly you've had an injury from years and you've never really addressed it, well, then it's going to be a pain in the ass to get rid of because it's been around forever and you have this tough as nails mentality, which might be okay in some sense, but there's a downfall to that too. So you kind of know when to address an issue and when it's okay to kind of push past the pain. What pains could be a good pain, like you just haven't moved in a certain direction for a long time and the joints are a little achy and stiff because of that. And what pains are going to be a worsening and aggravating pain, like a disc injury where you're just irritating the nerves by slouching, right? So you have to really have some, you probably should have an expert to tell you what's something you can lean into and what's something you need to avoid to desensitize your nervous system.
I feel like that's a big part of it with chronic pain type stuff is, like you said, when you have damaged some sort of tissue and then you go to, say you damaged it picking up a box. The next time you go to pick up a box, you have like this fear, you're catastrophizing about it. You're like, like delay term, I don't want my back to go out. All this stuff. So it's dealing with like that change and how to avoid the fear. When we all know through experience and everything like that, like eventually you're going to have to pick the box up. So how do you get someone from point A to point B where they're so scared to pick up the box to being able to like trust their body, trust the experts around them, telling them that, yeah, like movement is going to help this and try to move on from stuff like that.
Mm-hmm. I love that point actually about the catastrophizing and also with like the identifying with pain, because everybody's heard it, right? The old guy in the gym that's like, yeah, I used to squat 4 plates in high school, but now I have a bad back. And he's literally like, this is me, who I am. I'm the guy with the bad back. I can't bend down. I can't tie my shoes. I can't sit for long periods of time. And that thought process like makes it worse. And then it is natural when we do have an injury to try to just to be afraid of re-injuring the tissue. Like we see that in even high-level athletes, football players, basketball players. If they tear their Achilles, tear their ACL, like a bad injury like that, the biggest part, honestly, is getting them comfortable with playing again, because if you're playing tentatively in those sports, you're going to get hurt again because you're just going to get your butt kicked, basically. And so on our end, someone tears their ACL, that's easy. You go and get surgery or not, depending on it, and then we rehab it, we strengthen it. Like we have a whole protocol for that. But getting them back to showing that they're not going to re-injure themselves and give them that confidence, that's actually the hardest part, even for a normal injury. And we're talking about these long-term, like chronic 10, 20-year things, right? And so the way that you talk to your patients and the way that you consider pain is actually really, really important. And you don't want to put anything in your patient's mind that kind of like helps them identify with that, right? Like you never want to be like, oh, this is your good side and this is your bad side, or the bad knee or like this or that, like small little things like that. People can identify with that, and that doesn't help that fear and catastrophizing and everything.
Yeah, that makes me think of an interesting study that showed that early MRI imaging for, I believe, low back pain was associated with a worse prognosis. So let's say you're going in and getting treated and they're doing imaging right away and it really maybe isn't even indicated, but let's just see.
Yeah.
Look at your MRI, you have this degeneration, you have that degeneration, your disc, your blah blah blah. And so that person goes, I'm a broken person. I'm not coming back from this. And even on an unconscious level, that worsens your prognosis, meaning that your ability to recover from that injury is lessened just based on that subjective influence. And I know Justin has some interesting data on that.
I was just going to say, the stat man is here.
Yeah. This is what you get when you can look things up. It's fantastic.
Man, that might stick. I don't know.
Research is key here. Going off that, like pain doesn't equal pathology. And there's been numerous studies that have like demonstrated this. I found one from 2015. It was a RCT. They took, out of all the papers I found, 3,110 patients. They were asymptomatic individuals. They were looking at back or low back studies. So they did CT and MRI imaging on them. And they looked at a span from 20-year-old to 80-year-old, just looking at how the images presented. So in 20-year-old individuals, Just for disc degeneration, 37% of individuals at age 20 had some sort of degeneration going.
At age 20.
At age 20. And then by the time you go to 80, 96% of individuals had some sort of disc degeneration. And these are asymptomatic people who are walking around every single day with these pathologies, as this study put it.
Yeah, meaning they have no complaints.
Yeah, nothing. They're totally fine.
Yeah.
So 96, if you took 96 out of 100 MRIs of someone who's over 80, they would look terrible. And you would be like, oh my God, how is this guy even walking? And then they actually walk in your clinic and they're completely fine. So agreed. Pathology isn't always indicated by imaging.
Yeah, and that just goes with the whole MRI and prognosis type thing. So a lot of people with chronic pain are maybe suffering from previous injuries where someone has done imaging on them. They're like, hey, like you got this. And then as soon as the person hears that, oh, like brain shuts down, like, oh, I have a bulge. My disc is degenerating. Like this is going to cause all these issues. When realistically it's common findings and it's more of a brain matter than an actual physical like tissue matter.
It's interesting that you say that because like the minute before they got the MRI, they felt completely fine. And then they got the MRI and now they're like, oh, something's wrong with me. Like, no, nothing was ever wrong with you. It's just this finding on the imaging.
Yeah. Yeah, and I mean, you know, if you are getting degeneration, don't get me wrong, that's something that's going to have to be managed. And if you've got a lot of degeneration and arthritis coming up at a young age, maybe you're moving wrong and that is going to be a problem eventually. But first of all, regardless of what it is, it can be managed and you're going to get the best outcome for your health if you approach it with an optimistic standpoint, right? And yeah, the more you ruminate on that and the more you develop self-defeating thoughts about it, you're going to have a worse outcome regardless. So do deal with things, but also don't let them define you.
Yeah, it's all about setting like small attainable goals. Like you walk in and say your chronic pain is neck pain and you haven't been able to look over your right shoulder for 20 plus years. You come in, maybe you have 10 degrees of motion to your right. Hey, like today or this week after the next like couple treatments here, we're going to try to get that up to 5 degrees. Like just slow incremental like objective goals that people can follow to give them a little bit of hope to say like get through something and be like, oh my God, like, hey, I can turn my neck a little bit more than I could yesterday.
Yeah.
Like, and just build off that.
And you know what? I think what I find the most is that people that have chronic pain, they come in, they get treated for a bit, they improve in most instances.
Yep.
But it's when they, I'm feeling good, I'll just go back, you know, maybe they stop coming in, maybe they get into old bad habits. They forget about it. As soon as the pain's away, that motivation to go out of pain is away. And then it comes back and then, you know, it's catastrophizing. Oh, I'm never going to get rid of this. It's coming back. It's always going to come back. And that's where it's like, okay, even when you don't have that pain as a motivator, you need to address it as a lifelong managing thing, and at least until you're out of the woods for, you know, several years if it's a long-standing issue.
100%. And I think managing the expectations is super important, right? Because people will come in and be like, yeah, I've had these neck pain and headaches for 20 years. And then like when you don't fix that in 20 minutes, they're like, oh, well, nothing happened. It's like, no, like again, measure the range of motion. Oh, you didn't have a headache today for the first time in 20 years. Like all these things are huge. And especially with chronic pain patients that are more likely to get down on themselves and frustrated. And like, don't get me wrong. Like if you've had pain every day for 20 years, I feel for you 100%, but just showing them that like, okay, well, it's not going to be better in one visit, but we have seen it's getting better. That's my biggest thing. If I can see anything get better, even if that's not necessarily your main complaint or what you're looking for, I'm like, okay, this is something that we can work off of. As long as we keep making things better, we still have places to go. And it's exactly like you said, people are kind of forget that. They kind of forget that they've been in pain for 20 years. They come in, they're finally feeling like a little bit good, and then they'll either go out and do something that kind of like ruins all the progress that they've made, or they just like go back to their bad habits again and do the same thing that causes it again. So part of it too is just managing. We really work on managing the whole patient, right? Patients aren't just a spine and a nervous system and muscles. They're a brain, they have feelings, emotions, all those kind of things. And honestly, that's such a big thing, especially with chronic pain patients, to try to manage that as well.
Yeah. Yeah. And just to understand that for chronic pain, the treatment plan is so important because you're treating not just the body itself, but you're treating the nervous system, and the nervous system works through reinforcement. You're reinforcing that treatment, and you can spread that out as you get better, but you have to reinforce it, stay consistent, and just think of pain like a memory in that sense, and know that pain doesn't equal structural damage, right? Like what hurts more, partially tearing a rotator cuff or completely rupturing a rotator cuff muscle? Actually partially tearing it,
yeah,
right?
Same thing with breaking a bone, right?
Yeah.
All these things that as soon as the actual bad injuries are really bad but really quick. And so yeah, rupturing your Achilles, rupturing your ACL happens super quick. Sometimes it's a lot more painless than like a sprain or a strain or any of these more chronic things.
Yeah. All right, Justin, any closing notes?
No, I think that's basically it. Like it's through like the biopsychosocial model, like it's all about optimal load. Like whether you're stressing like their mental capacity to, like for the neck example again, their capacity to turn their neck to the right, anything like that. It's just about like small attainable goals where you're working and not loading the tissue too much. And a good way to do that too, if you think about it, like people who get total hip replacements are walking within hours, because just like that movement and getting like the body to not be like, oh shit, I can't do this anymore. Like, like getting people moving and having little goals like that is crucial to managing stuff.
You said a key thing there that was really important: optimal loading.
Yeah.
Right. We want to introduce stress to you in a slow, graded, slowly growing way, so that your body slowly becomes stronger and adaptive to it. Just like if you have a fear of elevators, the first day you might just walk up to an elevator. Second day you might press a button. The third day you might go inside look inside it. Yeah. Within a month you're going to be going up and down, because it's that slow introduction, and injury needs to be treated the same way. But it's about knowing where that fine line is so you don't step over it and re-aggravate it.
I don't know if you guys have ever heard this story. I forget the researcher, I forget how it was going, but he had a partial tear in his Achilles tendon. So he went up to his buddy who was an orthopedic surgeon. He's like, hey, like reconstruct my Achilles. He's like, no, I'm not going to do it unless it's fully torn. Like at that point, that's the only time they were trying to reconstruct him and stuff. So he goes home, he puts his toes on the stairs, and he lifts up on his toes and just drops. And he's ballistically loading his Achilles tendon, trying to rupture his tendon so his buddy could go and fix it for him. And after a couple of days, he's like, oh my God,
it feels better.
My Achilles tendon doesn't hurt.
Oh my God.
So if you think same thing with like the rotator cuff you were saying, like you have to impose some sort of stress to the system in order for it to like actually recuperate and regenerate and all this stuff. So if anyone's kind of worried about chronic pain, like you can load damaged tissues and they actually heal themselves. I think that's
we don't recommend that as like don't do that, let us do that. But that actually is a perfect example. Like think about it. Your Achilles tendon's hanging on by like a little thread, and people are terrified that they don't want it to be ruptured. And I get that, right? We don't want you to go through surgery, but there's a lot of stuff that we can do. And I always tell people in a situation like that, like at the beginning, the most that you might do, optimal for you, might be doing a calf raise with both legs in order to support the injured one. Maybe we don't do anything else because we don't want to risk it. But teaching people, I say this all the time, that just because something's sore doesn't mean that you're damaging it more. In a case like a torn Achilles, you have to be a little bit more careful, but like there's going to be pain involved in that rehab process, and that tension is the only way that things are going to get better. And so we help you. You don't know what's going to tear your Achilles. That's fine. You didn't go to school. That's our job. We're making sure that you don't do anything to tear it, but under our supervision, you can do way more than you think, and you can get back way quicker than you think.
Yeah, and that's kind of what we do, is we introduce the stress in a way that's going to minimize damage and maximize healing, right, in a controlled setting. And that's what we provide. And our treatment is the most effective first-line care for musculoskeletal disorders. And unfortunately, we live in the most drug-addicted time in human history, right? It's a huge and it's a growing issue. I think in the U.S., the number one cause of death under 50 is opioid overdose.
Insane.
And it's a growing issue. So if you do have chronic pain, please try not to rely or lean on that as your way out, because it's not a good way out. And seek some help or get it looked after, because there's a light at the end of the tunnel. You just got to stay the course. So thank you guys for listening. Thanks, Dr. Alex. Thanks, Dr.
Appreciate
Justin.
Yeah.
Bringing some good stuff to the table today. All right. Really, really appreciate the support, and we'll catch you on the next one.